Born Before 64 is a TV show that asks the vital question, what will we do for the rest of our lives? Kathryn Raaker hosts a show for baby boomers and above, inviting real people to tell real stories about overcoming issues, about facing with courage and triumph the significant obstacles many of us face every day. Born Before 64 TV shows will cover topics that this generation is interested in. So let's join Kathryn Raaker for Born Before 64.
Hi, Dr. Butler. I'm so glad to see you. It's been such a long time. You know, you've been on my show for many years, and you're our dental expert in everything dental. And, you know, the other day, I don't know if I was chomping on something, but guess what? That plate back there, it got a chipped tooth. I want you to see it. Can you check it out for me and tell me what you're going to do?
Such a common problem.
Really?
Absolutely. We see it all the time. You know, we had bridge work done in our 30s, you know, and 40s, and it was fixed to the teeth. And
right.
It's not implants like we do now.
Right.
So what happens is these things are connected across, you know, a little distance, and the things, you know, tend to flex a little bit when the jaw moves. So after, you know, 10, 15, 20 years, whatever, they always pop the porcelain off or get a cavity, and that's why implants are so much better, because they're all independent movement, so they last longer. Okay?
No,
so that's pretty common.
Here's my question. I don't feel anything, I don't think, down there. Is that?
Well, that's good.
That's
good because you don't have decay.
Oh, okay.
You know, the porcelain fell off, but you don't have decay.
Yeah,
so that's the good news.
Is that the good news?
That's the good news. Okay.
So let's look at it.
Yeah, we'll take a look.
And what's that?
Well, this is our new camera for intraoral use, and it's about 8 megapixels.
8?
And
wow.
it can put it right up on a screen, so we can look at it and get a view that you just can't get from looking inside the mouth.
Oh, can I see it?
Let's try that. Yeah.
Let's try it. Let's try it.
So here we go. I'll put this right here. I'm going to go back there where that fracture is. And now we got a perfect view of it. There we go. See? Mm-hmm. So it's chipped in 2 places.
Okay.
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 Now, breathe deep and then try not to breathe through the mouth for a second. Okay, open. And there you go. You can see it clearly. Fracture. I'm going to get the focus a little different so I can show it close up. Right? There. See that? Now I can capture that image if I choose, but that's what happens to these if we live long enough, and we're fortunate to still be here. So, but this is what we're dealing with. This is exactly what we're dealing with.
Right.
So if we redo that exactly like it is, then sometimes we don't even get the time that we had before because the teeth get worn and they get damaged. So what we do instead is we preserve the teeth with single crowns. And I can actually put that molar back in with an implant. It'll be a real tooth.
A real tooth,
that will never break, never wear out, never get a cavity.
Well, you know, I'm in television and radio, and you know that, and films, so I have to look the best.
Absolutely. And we'll also get the collar coordinated with the fronts, because the fronts have been
because the fronts
veneered, and they look fantastic, and we want to make sure we coordinate that collar, because that collar got old from, you know, just being in there.
For a long time?
Yeah, you know, it picks up stain and stuff. And
okay.
so when we redo that, it'll match your fronts perfectly, and then that'll help to complete your smile line. Because when you speak, you know, you have the lower teeth can show, and that's why we want to coordinate the collar.
Will it help my TMJ as well?
Yes, and that's an important point, because when you had that cantilever molar, it's never fully functional like a full molar, and when we do an implant, you'll have a full molar, and that'll better support your back teeth. So you'll have less strain on your jaw joint, because the more forward the forces are, the further you are from the fulcrum, and that's not where the good Lord intended us to be. So that causes a lot of strain on your jaw joints. So it will absolutely help.
Yeah, because I've been getting really bad headaches from it, and I've noticed that with the allergies and stuff I have, it's intensified. Yep. But I noticed that, and you also do Botox, I heard.
Well, it's an important point, too, and that's an excellent point. Especially, it's breakthrough stuff with TMJ, because people who are in a lot of pain, Okeson proved that it was always muscular hyperactivity, okay?
Right.
Well, it turns out that one of the best muscle relaxers, direct muscle relaxers, that can be injected into the muscle with a very tiny needle that you almost don't feel at all. And for 4 months, you'll have no facial pain.
Oh, that'll be great, because let me tell you something. That's been the worst problem that I've had, is that, I've had TMJ for a long time.
Right.
And I wear a plate at night.
Right.
And I notice that I'm clenching on my teeth a lot lately.
Exactly.
And
you can reduce the muscular hyperactivity from 50 to 90% using Botox.
Oh, wow.
And we use Botox brand, and with dentistry, we have a less dilution than you use for like face.
Right.
Okay, because it's a big muscle. And we can relax that muscle. Now, people think that Botox paralyzes muscles. It doesn't. It relaxes them because it competes with its natural mechanism of contraction.
Right.
So it'll relax the muscle from 50 to 80%.
Oh, that's great.
And that eliminates the pain, because it's the overstrain in the system that creates the pain.
And I think that I tend to smile a lot. So I use my facial muscles all the time.
Oh, yeah.
And so I know by the end of the day, I'm just like, I'm just so tired from with my clients and everything else that I'm dealing with all the time, that I notice that that's one of the things that bothers me more than anything else.
Well, a big part of that is that you generally have muscular overload, so when you use your facial muscles, it just adds to how much your jaws and teeth and your face have to work in coordination. So if you're already tired from TMJ, and then you have to use your face to work, then it really puts a strain on the system, and you can really feel drained from that, without question.
And that's one of the things that has been really bothering me a lot.
Well, relaxing the muscles that cause grinding and clenching is breakthrough stuff. And the studies are coming out now, and it works. And we put people on a 1-year program, and then it covers the whole year of treatment. And usually it takes 3 treatments for a whole year.
Okay.
And as that goes forward, Botox is an excellent preventive. One of the reasons to have Botox in your facial muscles when you have hyperactive muscles is that if you do that over a period of time, you get more relaxed muscles in general, so you don't have to do as much.
And I've done Botox in the past here, but I've never done it where you're talking about.
Right.
And I mean, that just seems really smart.
Well, I didn't invent it, but I'll tell you what, it works.
Right, I'll be a spokesman for Botox anytime.
That's the truth.
That's the truth.
Yes, but it's a great product, and we only use Botox brand because it's the most precise and longest acting.
It's been around a long time.
It's been around since '89.
Right, I love it.
Yeah.
I was one of their first people to do it.
One of the additional thing is that the studies have shown that you get less wrinkling of the facial skin over time if you use Botox regularly, because you're not constantly folding the skin. And so your long-term wrinkle outlook is a lot less than someone who doesn't use that.
Oh, really?
That's correct. It's a preventive, in other words.
Right. Well,
and this also prevents you from wearing out your teeth and bridge work.
Oh, really?
Because that was a contributing factor to breaking your bridge.
Really? I think I was clenching a lot lately.
Yeah.
I've had a lot of stress, though.
Well, it comes in cycles.
Really?
People that have the propensity for that, it comes in cycles. And when you're on a tough cycle, it really is hard on you. So,
right, and I've even been watching how I chew things and everything else.
Yep.
And that's been a little bit hard, too.
Yeah. Well, we'll be giving you injections, like I said, with a tiny insulin syringe, and you almost don't feel it. The ones I've done, the patients didn't even blink.
They didn't blink.
And it takes a very small amount to deactivate those big elevator muscles.
Right.
And then all you do is you can still chew normally, okay? But that hyper clenching gets stopped. Yes. That's correct.
That's the best thing in the world. I love that idea.
Yeah,
that's
4 months
great.
at a time.
4 months at a time.
Yep.
That's awesome.
And it's literally a 10-minute procedure.
10-minute procedure.
Yeah.
It's just walk in, walk out, right?
Yeah.
Go for
we
lunch.
mark the areas that we're going to put the Botox in, and you get less than a quarter cc put in.
Really?
In each of 4 spots on each side.
Wow.
And so it takes 10 minutes.
Right. Do you see how relaxed I am now coming to you?
Yeah.
You're such an easy dentist to work with. I love it.
So, well, that's some of the breakthrough stuff that we're working with, and it's really been fantastic, because people will wear out those splints, and it'll drive them crazy. They have to take heavy-hitting antidepressant or Valium or things that muscle relaxers that all have long-term consequences, and there is 0 long-term consequence of using Botox instead.
Oh, that's wonderful. I'd love to see that study, because are, and I wanted to have you on the radio show for that because I think that's really important.
Yeah, we'd love to talk about
You know, we do a lot of health and wellness now on our programming, and we are now on 129 stations for health and wellness every single week.
That's fantastic.
Isn't that great?
The word needs to get out.
The word needs to get
There's
out.
only, I think the less than 5% of dental practices are aware
Really?
of Botox treatment for TMJ.
Seriously.
Yeah.
We need to spread that word. That's really
Well,
important.
we're studying with the dentist spa people out of Miami, and they've done the most research, and they're partnered with Botox and Juvederm and people like that.
Now, let me ask you this question. Do orthodontists use it? I would think that they would use it. Do they?
Orthodontists who treat TMJ
Really?
can use it, yeah.
Okay.
But kid orthodontists, it really is not for them.
Okay.
So.
All right.
But there are orthodontists, adult orthodontists. Some of the best orthodontists in this country are adult orthodontists who help to counteract TMJ, and they treat all phases of it, and they're adopting this rapidly.
Well, that's good. That's important.
Yeah.
So then, do I still have to wear my night guard, though?
Some people don't.
Really?
Some people can get rid of it.
Really?
Not
That would
everybody.
be nice.
Yeah.
We'll see. Okay.
So.
Let me ask you this. How long does the procedure take?
Well, the Botox procedure for TMJ?
10 minutes.
Yeah, 10 minutes.
Okay, now, how long is this going to take to fix my tooth?
Oh, probably a little while.
A little while,
A
right?
little while.
Right.
So, but here's the nice thing.
What's the nice
When
thing?
we get done, that's going to be the last time we ever go in that corner of your mouth.
Really?
Yes, you bet.
I can
So,
deal with that.
It's going to last.
Because you know how I am in a chair. But you've
Yeah.
trained me right.
Yeah.
It makes it really easy.
Yeah. Well,
And-
we started with the smile, and that was a good move.
Right. I'll tell you what. Everybody asks where that smile comes from.
Yeah.
And I can't thank you enough. Everybody notices my veneers and the smile, and I'm not afraid to do it.
I did not want to forget,
What?
because we don't have pictures of your smile with the new camera.
Uh-huh.
I don't want to forget to put those in your file, so let's do that.
Yeah, let's do that.
right.
Okay. Ready?
So let me get you on the smile photo. We've already taken a full
All right.
face. So all we do is we place this right here, and we have your smile.
Wait a
There
minute.
you go.
Wait a minute, hold
Back
on.
here. Go right ahead.
How do you want me to smile?
Just
like
there
that?
you go. Anything you like. Oh, look at that. That's phenomenal. We can get it framed just right.